Good afternoon. Sorry to be a couple of minutes behind. I'm joined by the woman to my right who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli. To her right, another familiar face, the Department of Health's Communicable Disease Service Medical Director, Dr. Ed Lifshitz. Great to have you both. To my left, another guy who needs no introduction, the Superintendent of State Police, Colonel Pat Callahan. Paramount Garga's with us, cast of thousands. First thing today, I'd like to put out a reminder about the expanded child tax credit available to many middle-class and working families under the American Rescue Plan. This is major tax relief. For more information about the tax credit and to make sure you are enrolled to receive yours, please go to that website, childtaxcredit.gov. If you filed a federal tax return in 2019 or 2020 and already received your federal stimulus check, this expanded child tax credit will begin being distributed to you monthly starting in July. But if you did not file a federal return, you need to take action to make sure you get your tax relief. All working families with incomes of up to $150,000, or if it's a single parent household, $112,500, are eligible for the expanded child tax credit of up to $3,000 for each child ages 6 to 17 and $3,600 for children under the age of 6. There's no reason for any family to leave money on the table. This tax credit is here to support you and your family as we recover from the pandemic and move forward. Again, more information is available at that website, childtaxcredit.gov, and I encourage everyone to go there. And one more thing I'd love to encourage everyone to do is to support the small businesses in your community. Tomorrow I'll be signing a series of bills to provide further financial support for our small business community as they continue to recover from the impacts of the pandemic. And I want to thank our legislative partners for working on these bills with us. But while I know these supports are welcome, nothing is more important to our small businesses than the support of millions of you all out there. And one business I'd like to highlight today is Woodbury Antiques, a fixture on Broad Street in historic downtown Woodbury in Gloucester County, owned by that woman, Kathy Ferber. Woodbury Antiques is a cooperative that covers 17,000 square feet and features items from more than 36 vendors. Woodbury itself was a recipient of support from the Department of Community Affairs Neighborhood Preservation COVID-19 Relief Grant Program, which has helped numerous downtowns and business districts stay open for business. And with a direct grant, as part of that, Kathy was able to make sure that Woodbury Antiques rent was kept current so her vendors would have their retail homes waiting for them. With the grant funds, South Woodbury also created an e-gift card program that doubled the value of in-store purchases and which can only be redeemed at establishments which participated in the Neighborhood Preservation Program. This further helped Kathy and her fellow small business owners keep their customers. Today, our main streets from Woodbury to Woodridge and everywhere in between are open for business. Our small businesses are the backbone of our economy. Thanks to great people like Kathy, with whom I had the great honor of speaking, I think it was last Thursday, and businesses like Woodbury Antiques, I know we're poised to come back stronger than ever. And I thank Kathy and every small business owner who has kept the faith throughout the past 15 plus months. Check them out, by the way, woodburyantiques.com, woodburyantiques.com. It is well worth it, trust me. Now let's move forward with our numbers for today. This morning we're showing a total of 4,801,626 fully vaccinated individuals who live, work, or study in New Jersey. As I noted on Friday when we celebrated our crossing of our initial goal of 4.7 million, we had no intention of stopping. And today's numbers prove our commitment to pushing this total higher and higher. And as part of our Operation Jersey Summer, we have our COVID-19 Community Corps working door to door across a bunch of communities, municipalities, to make sure everyone not only has the facts they need to make the right decision about getting vaccinated, but that they know where to get vaccinated. And so far, our COVID-19 Community Corps team have knocked on more than, Judy, more than 134,000 doors. Incredible, right? In addition to, by the way, to making nearly 60,000 phone calls and texts. And I'll give you literally as we sit, this is this week's list, Dan Bryant, right? So they will be this week in Jersey City, Bayonne, North Bergen, West New York, Hoboken, and Union City in Hudson County, Passaic and Patterson in Passaic, Newark, East Orange, Irvington in Essex County, Perth Amboy, New Brunswick, Piscataway, Old Bridge, Woodbridge in Middlesex County, Camden and Gloucester in Camden County, Vineland and Cumberland, Trenton right here, Atlantic City in Atlantic, Howell and Middletown, my hometown, in Monmouth, Lakewood, Toms River, Brick, and Jackson in Ocean counties. As we promised on Friday, Judy, and predicted, and Pat was with us, we're not stopping. Just because we got to our goal, we have the hammer dropped. So I thank each and every person walking their communities to help us get the word out that the vaccines are safe, effective, and free, and that everyone who wants to be vaccinated has the opportunity to be vaccinated. They're doing great work to reach deep into our communities. And because we are now where we are in our vaccination program, we continue to see our daily case rates drop to record lows. Today, we are adding only 126 additional confirmed PCR test results to our tally, along with 42 presumed positive antigen tests. The statewide rate of transmission, which, by the way, we've said this now repeatedly of late, is almost exclusively measuring the spread of the virus among the unvaccinated, is 0.99, and the positivity rate is 0.95. Judy, there have been very few moments in this pandemic when we could have basically transposed the positivity rate and the rate of transmission and come up with the right answer. That has not happened terribly often. In our hospitals, we were down to only 233 confirmed, with 72 people awaiting confirmation. ICUs and ventilator use, you can see, are also continuing to drop. We had another, again, day of lower admission numbers, and stemming from the decrease in our hospital metrics, lower discharge numbers as well. I know we've been banging on the drum lately, especially, but the simple fact is that these numbers are being almost entirely driven by the unvaccinated among us. The vaccines have proven to be more than 99.9% effective in preventing serious illness and hospitalization. And there's a direct correlation between our increasing vaccination numbers and our decreasing infection and hospitalization numbers. So I cannot put it any more directly. If you don't want to be one of the numbers on our dashboard, go out and get vaccinated today, especially with the emergence of the more transmittable variants. The time to get vaccinated is now. We cannot risk any COVID brush fires in any communities where vaccinations lag. And sadly, we must today report an additional 3 deaths that are now confirmed to be from COVID-19 related complications. The reality is that death from COVID-19 complications is now largely preventable. So again, to protect yourself and your loved ones, please go out and get vaccinated. As we do every day, let's take a couple of minutes and tell several more of the stories from among the more than 26,000 of whom we've lost since last March. And today, given what I just said a minute ago, it must be noted that all 3 of these deaths that we announced with the heaviest of hearts took place this past December. So we're going to start by remembering a couple. This is on the left, Dung Pham and her husband, Din Lay. They were from Middlesex, Vietnamese immigrants who came to New Jersey in 1989 to make a better life for themselves and their family. Dung passed on December 27th, and Din followed her 3 days later on December 30th. They both worked at the Foothill Acres Nursing Center in Hillsborough. Dung was a certified nursing assistant. Din worked in the maintenance department, and they were both parishioners at Our Lady of Mount Virgin in Middlesex. Dung was a huge fan of Dancing with the Stars, while Din immersed himself in technology and a love of soccer, especially when the World Cup rolled around every 4 years, as it will do again next year, although this time, for the first time ever, it'll start in November. Together they love their adopted home, but they love their family even more. And that is the family that they left behind. So they had 3 daughters, Na Pham, Mi Tran, and Lana Nguyen, and their spouses. Their 5 grandchildren, Phuong Lei, Phuong Thi, Phuong Tran, Kevin Tran, and Dalina Nguyen. And I spoke with Dalina back on Wednesday, and she, by the way, she's the daughter of Lana Nguyen. Lana had COVID positive, and Lana's husband, Dalina Nguyen's father, had it so bad, Judy was in the hospital for 3 weeks. They also left behind their great-grandchildren, Vincent, Vivian, Phuong, Nui, and Tien An. Din also leaves another son, Lee, and a granddaughter, Anna, and Dong also left her sister behind, Susie. We are grateful that Dong and Din chose to make their American dream a reality in New Jersey. They added to the rich tapestry of our state, and may God bless them both and the extraordinary family they leave behind. And today we also remember this gentleman, Joseph Kieslowski of the Parlin section of Sayreville, Middlesex County. He was 84 years old. He was born and raised in Pennsylvania and served in the United States Air Force, as you can see, from 1954 until 1958 as a mechanic working on the B-36 Peacemaker bomber aircraft, rising to the rank of staff sergeant. He came to New Jersey in 1964, making his home in Parlin to begin a career in the real estate and home improvement industries. And he put his mechanical skills to good use, working on small engines, including for the lawnmowers and other landscape equipment he used to tend to yards and properties throughout Sayreville later in life. A job, by the way, that he did alongside his wife, Anna. Joe was also an accomplished woodworker, ready for this, with more than 2,500 birdhouses to his credit. He was a lover of polka music, a good joke, and an even better martini. He was predeceased by his first wife, Barbara, in 1997, and he also previously lost his brother, Peter. He and Anna enjoyed 18 years of marriage, and he's survived by her and his children, Joseph, Richard, Stephen, with whom I had the great honor of speaking last Wednesday, Deborah and their families, including his grandchildren, Nikita, Natasha, Garrison, and Quinn. He also left his stepdaughters, Natasha and Valentina. Joe's further survived by his sister Gloria and brother Robert and their children, and he also leaves family in Ukraine. By the way, Ukraine is playing, as we speak, a very important, consequential European Cup game. Joe passed on December 11th, and we thank him today for his service to our nation and for making our state his home for nearly 60 years. May God bless his memory and his family he leaves behind. So that's all I've got for this Monday. Before I turn things over to Judy, I simply want to reiterate what I said about her on Friday when we were together with Pat to celebrate our breaking the 4.7 million vaccination barrier. So much of our success is due to her steady leadership and constant focus on public health. I know Judy was taken aback by the quickness of my announcement that the new Department of Health building in Trenton will be named in her honor, but it is richly deserved. We know Judy has been the right leader for these times. And I know Judy would also want me to say that our success is ultimately rooted in the work that millions of you have undertaken to keep yourselves and your families and your communities safe from masking, testing, social distancing, everything over the past year, especially now to getting vaccinated over the past number of months. This has truly been a statewide effort, and we are going to win this thing. So with that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and also thank you for your kind words. Good afternoon. We marked a significant milestone on Friday, but our work goes on to vaccinate as many people as possible. I announced Friday that the Department of Health will be sending vaccine ambassadors to high-risk counties to work with elected officials, community leaders, school districts, and faith leaders to bring vaccines closer to where the people are, neighborhood pharmacies and doctors' offices and pop-up clinics and barbershops and churches. As the governor has said, COVID-19 is now largely a disease of the unvaccinated. So if you are not vaccinated, you are at risk for getting infected, particularly with one of the variants of the virus that are circulating and now spread more rapidly and result in more serious disease. And for those who have yet to be vaccinated or fully vaccinated, there's reason to be concerned about the increase in the highly transmissible variant, like the variant B.1.617.2, known as the Delta variant, the variant that was first seen in India. The spread of this variant, first identified in India in December of 2020, is another reason for us to remain vigilant and to continue to strive to increase vaccine rates. We are seeing the impact that Delta variant is having in the UK. We're following that, so we cannot let that happen here. The CDC upgraded the B.1.617.2 mutation of COVID-19 to a variant of concern last week. It has been detected in at least 66 countries, including the United States. According to the former FDA Commissioner Scott Gottlieb, the Delta variant is between 40 and 60% more transmissible and could become the dominant strain in the US sometime next month. Children and young people seem to be the ones spreading the Delta variant in England. So while this variant has increased in New Jersey recently, it is currently a minority of the variants that we're seeing. It's about 7.3% of the variants that have been sequenced in the last 4 weeks. The CDC estimates that it may be responsible for nearly 10% of all new COVID-19 infections in the United States. In some western US states, the variant may be responsible for nearly 20% of the cases. We do expect to see an increase in our state. However, the vaccines authorized for use in the United States have been reported to be effective against the Delta variant as well as other variants. In one recent study, researchers in the UK found that a 2-dose regimen of the Pfizer vaccine was 88% effective against symptomatic disease from the Delta variant. So as Dr. Fauci says, if you are vaccinated, you're going to be protected, which is another very good reason to encourage people strongly to get vaccinated. Also, as we have discussed, there are going to be cases of disease that we call breakthrough, even among those that are vaccinated. While we are not seeing any significant impact from the Delta variant at this time, there is a lag between a few weeks of analysis and reporting of the variants. So we're being vigilant every day to review that information. Earlier this month, we announced that the department had identified 1,319 breakthrough cases, which represents 0.06% of those fully vaccinated. That means 99.94% of individuals vaccinated did not test positive for COVID-19. On my daily report, as the governor shared, our hospitals reported a low of 305 hospitalizations of COVID-19 positive patients and PUIs, and that number continues to decline. Fortunately, there are no new cases of multisystem inflammatory syndrome in children. We have had no new cases since the beginning of June, and there were 127 cumulative cases in the state. None of these children are currently hospitalized. Also, fortunately, at the state veterans' homes, there are no new cases among the residents and no new cases among the patients in our psych hospitals. The daily positivity rate as of June 12th in the state was 0.95%. The northern part of the state, 0.92%. The central part of the state, 1.04%, and the southern part of the state, 0.90%. That concludes my report. Please continue to stay safe. Let's get vaccinated to protect ourselves, our family, and our friends. Thank you.
Judy, thank you. Thank you for the report, and thank you for all. We've got Ed here as well to answer any questions that may come up, so thanks to each of you. Pat, we get some pretty hot, muggy, humid weather. I suspect we get thunderstorms potentially. I know we had some over the weekend in some places, folks getting a little bit over the top, as it were. What do you got? And thanks for everything.
Thank you, Governor. With regard to the weather, obviously, it's hot. There is a heat advisory in effect for Mercer, Northwest Burlington, Camden, and Gloucester counties. We expect some severe thunderstorms tonight into tomorrow, but then it's obviously going to get nice for the rest of the week. We're watching that tropical storm, the third named tropical storm already off, that's heading out to the Atlantic through the Outer Banks right now, and we're, believe it or not, watching another one about 900 miles east of the Windward Islands. So always watching the weather, especially during this hurricane season. That's all I have, Gov.
Amen. And one thing, the heat advisory is a good jumping off point to remind folks for these schools that are still in their final days, and I think pretty much everybody by the end of this week is going to be out. I'm pretty sure that's right. You've always had the ability to get an exception to having to wear a mask if it were for health reasons, Judy, and one of the health factors or one of the considerations is high heat. So remember that, especially over the next few days where it's going to stay pretty hot. Thank you, Pat. Thank you all. We'll start, Ruth, is that you? We'll start over here. We will be on the similar rhythm this week that we've been on of late. We'll be with you virtually tomorrow, and unless you hear otherwise, we'll be back here live Wednesday at 1 o'clock. So with that, hello, Alex.
Hey, good afternoon, Governor.
Good afternoon.
Good afternoon, and good to see you again.
Likewise.
Hope you had a wonderful weekend.
Very nice. Hope you did too.
Yeah, had a great time on my boat. You have indicated on several occasions that you're proud of the fact that New Jersey has the toughest gun laws in the country. But these additional laws, which are all felonies, that make New Jersey the toughest are possessory only or permitting paperwork violations with no criminal intent.
Could you get the microphone a little closer to Alex? Thank you.
And they're almost exclusively forced against people of color. When you say that New Jersey has the toughest gun laws, aren't you really saying that New Jersey puts more blacks in prison for petty offenses than any other state in the country? Is this something that New Jersey should be proud of? That concludes my question.
Thank you, Alex. You've asked similar questions on this theme over time. I've really got nothing new to report. I mean, we have a state which we inherited with enormous inequities. This virus has laid those inequities bare. It didn't create them, but it's laid them bare. Everything from public health to education to housing to criminal justice system, and we're doing everything we can to shrink those inequities, and we'll continue to. Good to see you. Matt, welcome back. We'll get down front here with Matt, if you could.
Good afternoon. Governor, will the budget include an increased pension payment? If so, by how much? And is that for this fiscal year or the next? Members of the Atlantic City Council say they sent you a letter requesting the state police take control of the local police department in the wake of an uptick in serious violence there. What are your thoughts on their request? And finally, candidly, what restrictions are left under your control? For example, the legislation that dealt with emergency powers said that, for example, masks would be tied to CDC guidance. So what is left under your control, and when do you expect those to be lifted, going at the point we're at now?
Pat, you may want to come in on the second one, but on the pension payment and other budget matters, other than the announcement that the Senate President and Speaker and I put out this morning, along with the budget chairs, talking about some more aggressive tax relief, which we're all, I think, collectively very proud of. Nothing to report beyond that. Although, as I've said to you, I don't think it was to you, Matt, but as I said last week or the week before, if there's an opportunity to put more money against any of the structural deficits as a state that we have, color me between open-minded and enthusiastic, and obviously if we could, one of the big ones would be the pension system. Secondly, I'll jump to restrictions. Judy, tell me if you see this differently. The ones that are left, and again, we're looking to the CDC overwhelmingly for these, are basically the big ones are wearing face coverings in places that are either vulnerable, healthcare related, or transit. So it's buses, planes, trains, healthcare facilities, long-term care, other vulnerable communities such as a corrections setting. Those to me are the big ones that are left. Would you agree with that? I've not seen the letter. we care deeply about Atlantic City. It's on that list of communities. As it goes, in many respects, so goes New Jersey. We have succeeded in migrating from a boot on top of them, top down in terms of the relationship, to a partnership. And I give the Lieutenant Governor an enormous amount of credit for being the lead person from our government in that partnership. And that includes the whole gamut of interests in Atlantic City, including public safety and law enforcement. And we'll continue to take that extremely seriously. Pat, any comments you had?
I would just add, after we had that town hall a few weeks ago, Governor, on public safety and public health, that Atlantic City Council Vice President Kaleem Shabazz has asked me to come on with the council on Thursday, which I will do virtually. We support Atlantic City with an Atlantic City Task Force, our crime suppression, our real-time crime center that's down in Gloucester County. So we do it. As far as the notion of sending in marked patrol, troop cars, that's still yet to be determined, but it could be certainly on the table. But we're similar requests are coming in to us from our major cities across the state.
Yeah, listen, it's not specific, Matt, to Atlantic City, but I kind of alluded to this in the exchange Pat and I had before we took questions today. And this is not unique to New Jersey. There's a lot of behavior right now, I suspect partly due to, if not a lot due to, coming out from the pandemic. 95-degree high humidity weather does not help. There's a lot of kinetic activity in the state right now and in the country. We saw, I'm in Monmouth County, we saw some of that over the weekend. And so this is not just a matter specific to Atlantic City. And we've seen upticks in gun violence in the state, in the country, and we just got to plead with people to. We get it. Everybody wants to get out there and unshackle themselves from this pandemic. Who could blame you? But please, God, do it responsibly. And we'll continue to have the honor to work closely with Atlantic City on all matters, including public safety. Mike, is that you?
Yep.
Good afternoon.
Good afternoon, Governor. Thanks. I'm curious if you could explain how you decided to move away from the 70% of adults vaccinated. How did you weren't talking about that number on Friday or today, focusing instead on the 4.7 million. Could you just talk about the decision making there? And is the percentage then that the CDC is using the percentage that we should be using to report to people and that the public should look at to understand? On the budget agreement that you announced today with the legislative leadership, is there an overall budget deal, or is that still being negotiated? And then on those pieces that you announced today, if you add them up, they come to about $126 million in the new tax relief that you're talking about. That $300 million for the $500 checks was announced previously. It's no doubt that I'm sure that will help some people, but that's also just a small fraction of the $10 billion surplus that the state has. So why not do more tax relief? Or what else do you plan to do with the rest of the budget surplus? Thank you.
We haven't moved away from the 70%. In fact, we will hit it. I don't want to make news today because we're not hitting it today, but we'll get there within a matter of days. So I think the reason why Friday, by the way, we'll put that day up in lights as well. These are both milestones worthy of celebrating. But the reason why I think Friday was more relevant, when we started this way back on December 15, the eligibility for the vaccine was far more limited than it has become. And so we wanted to make sure somebody who's vaccinated in the state, that matters. We need to celebrate that because they would otherwise be exposed. They could otherwise transmit the virus. So it's and both. And I think, Judy, on anything you want to add to that, but on the CDC, we obviously look to their numbers. I think they're going to actually make some announcements later today. You had mentioned to me earlier, right?
Yeah, my understanding is CDC will be coming out with an MMWR that looks at age breaks and race and ethnicity. We've been working almost every day with the CDC to reconcile their numbers with our numbers. And there's a lot of movement. For example, the federal pharmacy program, the reporting of their numbers was significantly lagging due to a third-party vendor that had significant backlogs, and we're just now catching up with all of those backlogs as well. But we're pretty close right now with the CDC through a lot of reconciliation and working with them and looking at what's present in Tiberius. And all in, at this point, we're like 4.8 million as of this morning. So 70% still stands. We won't rest till we get 70% in every county and municipality.
Amen. Nothing, again, Mike, on the budget deal, no news to report other than what we'll put out already, but it's been a very constructive process, and I have to give a big shout out to the legislative leadership led by Senate President, the Speaker, the budget chairs. It's been really good. And I think that gets to your last question as well. Stay tuned. There are lots of moving parts, and I think when the entirety of this, and at the point that we feel when we can talk about the entirety of the budget, I think it's going to be one that we can all look to and say that it makes the sort of investments, provides the sort of relief, that it's balanced in that, including investments, as Matt asked, addressing the structural deficits that have been building for decades in the state. So stay tuned. Alex, good afternoon.
Good afternoon, Governor. On May 12th, in this room, I asked you if you were going to count 12 to 15-year-olds as part of your 4.7 million vaccinations goal. You said, quote, the objective is 4.7 million initial, 70% of our adults, so we define adults as 16 and up. You continued saying we're not going to use that, the number of 12 to 15-year-olds, to leg into that objective. When did you move the goalposts and why? Were you concerned that you were falling behind your vaccination goal, or were you not telling the truth on May 12th? A budget question as a conceptual matter. The Senate President has announced $500 rebate checks for property taxes will be coming out starting July 1st. If you're interested in lowering property taxes, and who isn't, why not take the $319 million from the millionaire's tax and give it to municipalities or school districts, or use it to encourage consolidation, which would truly drive property taxes down in the long term? Is this just about an election year gimmick like Brendan Byrne, sending out a check with your name on it to folks? Lastly, you've promised a postmortem for more than a year on the state's...
Promised a what, sorry?
A postmortem.
Yep.
In your words, on the state's COVID-19 response. When will that begin, and will you commit right now to at least starting that postmortem before Election Day?
Alex, I love your questions. I think I've answered your first one. We're going to hit 70% within a matter of days. I can't tell you exactly, probably soon after we had the ability to vaccinate the 12 to 15-year-olds. It's pretty obvious that a vaccinated person who lives, works, or studies in New Jersey is a vaccinated person that is helping us in our overall public health objectives. Not only helping themselves, it's helping us be a healthier state. So it's and both. The goalposts are right where they were. We're celebrating both of these, and I think we've been quite clear about that. Nothing else to add on the budget front other than to say one of the structural deficits that we inherited, pension plans where there hadn't been a full pension payment for decades, outstanding indebtedness that was exploding, healthcare costs for public sector employees that were rising both for the employee as well as the taxpayer. Just one structural deficit after another. Property taxes right up there. I'm proud to say that 3 of the 5 lowest property tax increases ever on record are the first 3 years of our administration. I'm very happy, as we announced earlier, that we're at long last going to update the basis upon which the homestead rebate is calculated. That may sound technical, folks, but trust me, that's a good thing in terms of property tax relief. All-time record up until now. I don't want to make any news in the budget, but you can assume that this is in the ballpark. All-time record investments in public education. Why does that matter? Because on average, 53% of your property tax bill is for public education. So the more the state picks up the tab, the less the locality has to pick it up, and that's good news. So we're going to continue to chop away at this. And there's no gimmick here. This is cash on the barrel. And the millionaires tax, so-called millionaires tax, that's going to be directly into checks that families up and down the state in the middle class and those aspiring to get into the middle class are going to receive. We're absolutely committed to doing a postmortem. In fact, I was with Governor Kane, sadly, at a memorial service on Friday, and we had this conversation both about what should be happening in America with January 6th, and he's been quite vocal about that. I think you may have mentioned that, or we exchanged on that. But I reiterated to him that we would have an absolute full accounting of the pandemic and the response. And by the way, lessons learned and require, public health infrastructure, for instance, that we need going forward. I'm not going to commit to exactly when that is because we're still in the game here. Although thank God, it's gotten a lot better, as we all know, over the past couple of months. But absolute, unequivocal commitment to that. Thank you for that. Good afternoon.
Afternoon, Governor. Advocates at a Juneteenth rally this weekend in Newark called for the creation of a reparations task force and say the wealth disparity task force you recently announced does not go far enough. They're critical that the word reparations is not included in the conversation. What is your response, and do you support a reparations task force?
Listen, how great was it we were able to celebrate Juneteenth as a state holiday, huh? In fact, we were together, the three of us, on the holiday. So much for taking a holiday. But of course, because it was a Saturday, we celebrated as a state and as a country. And I think that's another great thing that happened with a lot of bipartisan support and quickly. And I thought that was a great, given all this period of us versus them that we've been battling through as a country, I thought that was a pretty darn good sign. I would just say after we were together, Judy and Pat, in Newark, I had the honor to go up to Patterson and at Calvary Baptist Church with Pastor Lassiter and a great group of community leaders, elected officials, Mark Moriel, who's the president of the National Urban League, among others, and signed the most progressive anti-discrimination housing law in the country. The notion of ban the box now applied to housing. And we heard from an extraordinary guy whose life has been in the negative and now in the positive, will be directly impacted positively by this. And then I also announced the chairs of the Wealth Disparity Task Force. And that's going to be a game changer. I mean, this is looking at all reasons, particularly in black and brown communities, why the gap in net worth is as staggeringly wide as it is. So it's all-encompassing. This is a far-reaching endeavor. 4 co-chairs, including led from the government side by Lieutenant Governor Sheila Oliver. And the numbers are staggering. So this is a huge piece of unfinished business that has been building for centuries. 402 years, I believe, since slavery first came to our shores in that respect, and also the decades of the carnage created by the war on drugs. But if folks don't know the numbers, they need to understand the numbers as a first step. And you're talking about gaps in net worth that are 40 to 50, not percent off, times off. If you're on average, an African-American family or a Latino family, you look at their net worth and you compare it to a white family, it's literally hundreds of thousands of dollars in the latter, and it's under $10,000 in both of those communities in the former. We got to do something about that, and it's a far-reaching reality in terms of why we are where we are, and it's going to need to be a far-reaching scope of that task force. And I'm happy that we've finally been able to stand it up. So thank you. Do you have one, sir? Yeah. Okay. I didn't think you had one.
Good afternoon, Governor. It's been a couple months since I've been here, so I got a couple of softballs for you. Maybe bring down the temperature.
By the way, you don't need to stand. If it's
happy to.
Okay.
So, Governor, first of all, a belated Happy Father's Day.
Thank you for that. Same right back.
Callahan. In my 40 years of covering, sort of as a hobbyist, the budget. This, I think, to my memory, is the earliest we've had a budget agreement between the 3 men in the room. So congratulations on that.
Thank you.
And then, Governor, I'm sure, given your Celtic heritage and yours too, Colonel, You didn't let June 16th pass you by, and how did you and your family celebrate Bloomsday?
Which day, sorry?
James Joyce, Governor.
Oh,
Bloomsday, June 16th.
Yeah.
I would have bought you a pint myself had I known.
Well, it doesn't, I don't want to put words in Pat's mouth. It doesn't take a whole lot to get us over the goal line on having the pint, but I don't know that I did anything unusual to celebrate that. Did you? This was last Wednesday? A pint or two? Okay.
Well, my boys and I had pints and scones. Proper James Joycean Bloomsday. So thank you, Governor.
I will make note of next year we'll be more adherent on the holiday. And happy Father's Day back. Thank you for that. Dave, good afternoon.
Hi, Governor.
You'll take us home.
No questions about pints.
Okay.
The state has basically, New Jersey's basically reopened now, but the state is still acting like the pandemic is in full swing when it comes to our state buildings, including this one. All of the reporters in this room are wearing masks. The MVC still closing offices for weeks if anybody tests positive. The labor offices are not open yet. Courts are still shut down. I've been told buying and selling a house is a nightmare because people can't get the paperwork that they normally are able to get. For state facilities that are open, as I just mentioned, you got to still wear a mask indoors. So when will the state offices reopen? People want the option of talking to a human being face to face instead of doing everything on the phone. And don't you think that taxpayers have the right to use these services? Next question, some town school boards, the latest, my understanding is Middletown, are already announcing mask policies for when classes begin back in September, saying masks will be optional unless they're required by law. What's your reaction, Governor, and is there any concern on your part that this could start to spiral out of control before we even know what's what in August, for instance, when we're going to have perhaps different COVID metric numbers to deal with, and you mentioned this last week, hard to figure this out in June when school won't open again until September. And then finally, 2 points of clarification. You announced the budget deal on the middle class tax rebate and the homestead rebate this morning. Who is eligible? What are the cutoffs for this eligibility? Thank you.
Okay, Dave, I'm going to probably need Paramount to help me out with the last one. I want to make sure I get it right. So state offices, nothing, not making news today, but that clearly is not a forever and for always. This will change, and my guess is it's generally in the sooner than later category. Sue Fulton just weighed in from Motor Vehicles and said they haven't closed an MVC since May 7th in Eatontown. God willing, it'll stay that way. And I think that your point is a good one. Folks have a level of comfort, even if it doesn't move the needle on the actual, whether it's an MVC experience or an unemployment benefit claim experience. There is some amount of comfort that we understand completely, even if the substance of the interaction does not have any different timing or outcome. But I'd say largely in the sooner than later category. And again, we keep having the numbers like Judy and Ed. We got to bring Ed in from the bullpen here. Ed, could you walk through Dave's questions on the budget for me? Sorry. Listen, on mask policies, I would just, at one level, completely understand why folks don't want to have their kids wearing them. I hope they don't have to wear them either. So I get that completely. But unlike an HVAC system or some other capital investment, even more modest ones like plexiglass or signage on the hallways, one-way versus two-way, and I'm not suggesting we should wait till Labor Day at 5 o'clock in the afternoon, but you could literally make that decision then for 8 a.m. the next morning. It's literally, do I put this on or not? And so I understand everyone wants to get to that point, and knowledge is important. We've actually got a meeting on this later today, so we're beginning that process ourselves to try to predict what it looks like in the fall and get some sense of what the parameters are like. And I would just ask everyone to just have some patience. Paramount, eligibility on the tax programs, or do we want to get back to Dave separately?
Yeah, so the details on the middle class tax rebate are largely what they were announced this past September. So it's up to $500 with an income threshold, and there's a sliding scale based on the number of members in the household and the amount of income that the household makes. For the homestead rebate, it's largely updating the base year for purposes of the calculation, but we can get you the details offline.
Yeah, tell me if you agree with the statement. The homestead rebate eligibility did not change. The basis upon which the calculations have changed. And I believe, if I've got this right, it's updated from budget year 2006 to budget year 2017. Is that correct? Again, so no change in eligibility, just an updating in the numbers, which has the salutary effect of giving more money in people's rebate. Ed, serious question before we break. We got to get our money's worth here. Judy's talked about the Delta variant. Since you were last with us, it's clearly become more prevalent in the country, where we've got the best data, but also here. We've mentioned many times that the UK, among other reasons, is getting harder hit. I guess the science and medical experts believe, such as yourselves, I might add, that by stringing out that second booster shot, there was an exposure there that that this variant is particularly is taking advantage of. Any other color on that? How concerned are you? Do you see the gap between the vaccinated among us and the non-vaccinated to be as bright a line as we're portraying?
Clearly, the vaccines work. Clearly, the vaccines are extremely effective. They're never going to be 100% effective, and whether they're any less effective against Delta or other variants, it's not 100% clear, but they are looking to be very effective against these variants as well. So that's the number one takeaway message. Go ahead and get vaccinated. It will protect you. It will protect other people. It will help protect against new variants continuing to come about that might be able to get around the vaccines in the future. So extremely important to go ahead and get vaccinated. The Delta variant in particular, it is clearly out-competing the other variants, which means it's more transmissible. It's getting there more. It's becoming an increasing percentage in New Jersey and other places as well. As of now, while we've been seeing those numbers rise, we're not seeing particular numbers rise as far as hospitalizations or other things go, so that is certainly reassuring. So overall, at this point, I'm cautiously optimistic as far as the Delta variant, meaning that I do believe that vaccine is very effective against it, that those people who do get it are not likely to become more sick than people who get other strains of it, and clearly, while I can't say for sure the vaccine is as effective as it is against all other variants, it certainly looks to be very effective and may well be.
And again, it's a good reminder to everybody that the second shot matters. And we've been running ahead of the national average on the second shot. We have to continue. So don't assume that you're protected to the extent that you may think you're protected if you've only gotten one of this is obviously of the two-shot vaccines, Moderna and Pfizer. Ed, thank you. Judy and Ed, thank you as always. Pat, great to be with you. Paramel, Dan, Ruth, everybody else. Folks, keep up the great work. Please stay safe and cool in this very high heat. Thank you, folks, for doing everything you've done by the millions. Please get vaccinated. Stay safe. We'll see you back here on Wednesday. God bless.